a vacation from their talks. David and Liz, back to you.
Busy summer. Not much suntan time this summer. Thank you very much, Peter. No. Well, will we see a deal on health care in the Senate before time runs out?
Let's talk about it with Senator Robert Bennett of Utah. Welcome, Senator. Thank you for joining us.
Thank you.
Well, can we ask you, do you think there will be some type of deal, some type of opportunity to get some headway here, or no?
Well, if you mean before the recess, the answer is clearly no. The recess is going to take place probably at sundown. The House has already been gone for a week. So, no, we're not going to have any kind of thing out prior to the time we leave.
Now, the debating, if you can call it that, outside of chambers is getting pretty rancorous. I mean, you have the president calling the grassroots protest movements astroturf. You have Nancy Pelosi using even tougher terminology to refer to on these protests that have been taking place at these town hall meetings. Do you think this is a genuine grassroots movement against massive change in health care, or is it astroturf, as the president says?
Oh, it's genuine. The question is, how broad does a representation does it have? But it's not orchestrated. It's happening spontaneously. And the challenge that they're facing as they have these negotiations is that they're talking all around the major problem. And the major problem is, how much is this thing going to cost? We keep getting told, well, we're working on that, or we're going to find some pay-fors, we're going to find some offsets. That's beltway talk. Offsets means you take money away from something else to put money here. If you're going to have real health care reform, the health care costs themselves have to go down. They don't have to be paid for by somebody else. If they're paid for by somebody else, that means they continue to go up, and they're not accomplishing what the president promised that they would accomplish. You've got to have a reform that saves money in the health care system. And if you don't do that, the CBO is going to continue to talk trillions of dollars, and people are going to continue to protest against it.
Senator, if you and the GOP succeed in beating this concept down and beating it back, and it fails, and we're left with nothing, is that a victory that would make you pleased, or is it somewhat of a Pyrrhic victory in that we're left with rubble here? We still have 46 million uninsured Americans. Do we start all over? What do you think?
Well, number one, I do not want a failure. I want a solution. And I think the majority, if not 100% of Republicans, ultimately want a solution. But in your question, I think you focused on the wrong thing, and that's one of the reasons we're having so much trouble. You focused on those who are uninsured. All right? If the whole the whole activity is to cover those that are uninsured with the present system, or some variation of the present system, that means you're going to add costs to the present system. My position is the present system isn't working. And if we focus on making the present system work, we get the costs down, and guess what? As a byproduct of making of junking the present system and doing something intelligent in its place, those 46 million are going to get coverage. That's a byproduct of doing this thing right, and it is the focus on that that is causing us to do it wrong.
Well, Senator, the present system may not be working in some areas, but a lot of the small business people we've been talking to, and the middle-sized business people, say we don't want massive change to create a new government insurance company, a government-run and operated and paid-for insurance company, without some insurance of our own that we're not going to have to pay a price that's going to drive us out of business. You used to run a business, Franklin International, which started from 4, grew into 1,000. Aren't you concerned about the small and mid-sized companies that may be destroyed by this?
Absolutely, absolutely. And I am with them in everything that you have just quoted them as saying. But the option is not a government-run plan. Getting rid of the present system doesn't mean going to a government-run plan. It means going to a true market in healthcare, which we don't have today. Right now, healthcare is the only place, and it's about 17% of GDP, where the person or the entity that receives the goods and services doesn't control the money that pays for the goods and services. The money's being controlled by some third party, be it the employer, in the case of the employer-based system, an insurance company, an association, or overwhelmingly the government itself. We've got to get into a circumstance where the people who are getting the goods and services control the money that pays for the goods and services, they will start to make choices. They will start to create pressures within the marketplace that will bring the costs down, raise the quality up, and in the process, as I say, cover the uninsured. That is a system that's at the base of the bill that Senator Wyden and I have introduced. We have 12 co-sponsors on it now, Republicans as well as Democrats, and a number of places have editorialized on it favorably. But because it is not just tinkering with the present system, we don't seem to be able to get the committees to pay any attention to it. But I think as they begin to look at their costs, they're starting to pay attention to it, because we have a score that says our plan will not only cover everybody in the United States, but it will save $1.3 trillion over the next 10 years. Nothing the president or the Congress is talking about can do that.
Well, we like the idea of bipartisan ideas, so keep us posted and we'll follow it. Robert Bennett is Senator
Always
out of
happy
Utah.
to come.
Thank you very much. Enjoy your vacation,
Thank
Senator.
you.
Appreciate
Thank
it.
you.
Well, House lawmakers already are home for the recess and getting quite an earful from constituents about the health care bill.